So here's Kirk Rosin for 2nd.MD.
Appreciate it, thanks. And I'm obviously the new kid on the block. And last year about this time, I left Aetna, where I was the head of client strategy and innovation for Aetna's North American business. And I left to go to this small rowboat called 2nd.MD that had just gone through this whole NBGH process where it was Shark Tank-like evaluation process. We ended up being named the Innovator of the Year in 2015. And it really put us on the national map. And what drew me to 2nd.MD initially was the value proposition. The best doctors in the world available by video within 3 days. There's a lot to that statement. And that's what initially drew me into the conversation. But it wasn't until I met this gentleman, who's our founder, Clint Phillips, and understood his story on how he created 2nd.MD and why he did it, that I really got hooked. So Clint, born and raised in South Africa, had a spine clinic helping people avoid back surgery in Aspen, Colorado. He and his family settled down there. When his daughter Gabby was born, shortly after she was born, she had a stroke. And so Clint didn't even know that infants could have strokes. His daughter was paralyzed on her right-hand side, unable to move her face. He drove 4 hours to the nearest pediatric neurologist in Denver, who said, "Sorry, Clint, your daughter will never walk or talk." And so you can imagine the anguish in a dad just wanting to get care for his daughter and saying, I don't know if that person knew what they were talking about, or if I'm resigned to my fate of caring for my daughter the rest of my life. Either way, I've got to make sure that what I heard was correct. So he scheduled an appointment with the head pediatric neurologist at Texas Children's. He waited 4 months, filled out a ton of paperwork. 2 minutes into that particular office visit, that pediatric neurologist said, "Sorry, Clint, I don't handle stroke, but I know somebody that does." There's another 3-month waiting list. This went on for a year. Clint walked away from that knowing his calling, said, "Listen, no one in this country, no one in the world should ever have to wait, travel, or fill out a ton of paperwork in order to speak to the best expert in whatever condition they are faced with." And so that's the premise of 2nd.MD. That's the backstory. And I've been in healthcare for 20 years, spent 15 of that in consulting, spent my time at Aetna. There were a couple numbers when I started talking to 2nd.MD that I had never heard before. The first is in the upper left-hand corner, that's 17 years. That's the average number of years that the typical physician is behind on medical research. So those things that were stamped as the gold standard treatment for certain conditions 17 years ago are just finally making their way into the medical community today. That's shocking. The other one, I think we've all experienced. We all get 8 to 9 minutes with a physician, right? Only one of that is spent talking about treatment and treatment options. And if you get a bombshell of a diagnosis, that 1 minute just simply is not going to cut it. And there's some other things that are going on within the system, right? And there's some things that we didn't talk about on the carrier side because it was tough. There's a lot of misdiagnosis going on. And there isn't a lot of data behind it. There are a few studies. The one on the left is actually from Johns Hopkins. They did autopsies of individuals who passed away in the ICU. 28% of those individuals had at least one misdiagnosis. Our data suggests it's higher than that. The other kind of systematic thing that's going on, I think we've talked about a little bit today, is that there's so much variation in treatment plan. If you go see an orthopedic surgeon about your back, chances are you're going to get cut, right? And what we've seen, and I'll share our data in a second, is that a lot of the musculoskeletal type conditions, a lot of those decisions are really just, there's a range of treatment options that an individual can consider. So as we look at our business model, we're primed to reduce the unnecessary services that are out there and help correct the misdiagnoses that are being made in some critical areas. So where we fit in, and this is some of our new positioning that we've taken to Fortune 100 customers, is that there's a very valuable role of insurance, and that is to provide financial protection for the people that it covers, right? But where does the getting to the best expert, getting the right answer, where does that come into play? And that really comes through with a suite of assurance offerings. So Compass, I would put Compass as a service in that assurance offering. 2nd.MD as an assurance offering. And it's only when those two come together is that member connected with the best outcomes for that specific individual. So our service, if you think of MD Live for fevers and sniffles and earaches, we're everything else. So we are the specialty go-to service. And there are essentially four situations that an individual may come to us where we're most able to help them. First, if they have a new diagnosis and they just want to talk to somebody, they want to get education around that diagnosis. Secondly, if they're told they need to have surgery, they can come to us and get a second opinion on whether or not that is in their best interest. Third, if they had to have a change in medication. We've talked about specialty pharma today. There's going to be a lot more coming out, a lot more new drugs coming out over the next couple of years. You know, how do you know that it isn't just a marketing push that your doctor's prescribing a change in medication? Our experts can help work with the member to understand exactly what that means. And then chronic conditions. You know, if somebody's following their disease management protocol, if somebody's working with their chronic condition, but their situation continues to get worse, there may be a misdiagnosis. There may be something else going on. And our experts, and I'll talk about what their qualifications are, they're able to see through the noise. They're able to use data to say, hey, listen, I know that your original doctor said this, but I really think there's something else going on. And so that's really where, from a chronic condition standpoint, we can help folks that have kind of gone through the typical processes. On the right, you see the most prevalent conditions that individuals are coming to see us about. And that's cancer, musculoskeletal, female reproductive, neurological conditions, very rare pediatric genetic disorders. There hasn't been one condition that's been presented to 2nd.MD over the past 5 years that we have not been able to match an authoritative expert to. And that's a bold statement. We've had some very rare conditions that have been presented to us. And in one instance, we were able to match that particular family and their child with a rare pediatric genetic disorder with the exact specialist who discovered that condition and was one of two that helped treat it in the entire world. So we have scoured the specialty community, and we know who these folks are. But we're not the first in the game with second opinions. And I will challenge everybody in this room to think of us as expert decision support versus second opinions. Because second opinions have been around for 25 years. The challenge is nobody has used it. It's been a very long, paper-oriented process that's been set up around the convenience of the provider, right? And so if I'm somebody who's going to use one of the traditional second opinion services, I'm going to talk to somebody and then wait around 4 to 6 weeks in order to get a 30-page written report. I don't ever get to speak to the specialist. 2nd.MD flips that on its head. There's direct interaction between the member and the specialist. The specialist gets asked the member questions about their condition, get additional data, which results in a higher degree of clinical precision. The member can ask the specialist any questions they have about their condition. And so that is a truly unique opportunity to get personal feedback, to run the conversation through a personal value system of that member so that they can come to a conclusion of what's best for them. And it's not just getting a written report back. And what we've seen on those circumstances where we've taken over clients from some of the traditional is that we are generating between 5 and up to 20 times the utilization. And we're not a week-long process. We turn these consults around in about 3 days. So it fits very well within the consumer's decision flow, which is very important when you think of somebody who has an oncology diagnosis. They're not going to want to wait 4 to 6 weeks to start treatment. They want to be reassured that they're speaking to someone who knows more about that condition than anyone else in the world, and they can do that within the next couple days, and then they can start their treatment plan. So it's an incredibly powerful benefit that employers are rolling out. And similar to the evolution of consumerism, we are the next iteration because we are supporting members in their decisions in real time. So there's an element of the price transparency tools, there's an element of the health advocacy and navigation services like Compass provides, but when things get very challenging from a clinical perspective, we can be that next step. We can be that support mechanism that can help those individuals with the complex diagnoses. So our experts, we have over 400 specialists that we have signed exclusive deals with. We formed our panel to encompass every single one of the 120 recognized subspecialties. And we started with the institutions you see here. And we looked at leaders within those institutions. We looked at the individuals that folks were traveling around the world to physically go see. And we said, hey, we're coming up with a video platform that's going to enable you to expand your reach and do so in a very convenient way. Would you be interested in participating with us? And resounding, the answer was yes. And so we've contracted, as I said, with over 400 specialists on this platform. And we also ensure that these individuals are conversant in the latest evidence-based guidelines. They have to have led at least 20 clinical trials or have been published on peer-reviewed studies at least 20 times. So they can refer back to the clinical literature off the top of their head because many times they've led those processes. And so the question I always get is, all right, so why would these individuals want to participate with you? And so I'll let one of the doctors speak for the rest of the staff.
I've been working with 2nd.MD for several years. It has provided me the opportunity to extend my ability to deliver second opinions. I think more importantly, however, it has offered a vector for patients who really may not have the kind of access that they would like to have to qualified physicians. So the platform has been really efficient for me. I can tell you I'm extremely busy, so I need to have a system in place that is very streamlined. Going to the website, getting access to the history, previous physician notes, objective testing such as x-rays and MRIs, operative notes, and so forth, has made it really, really easy for me to quickly get the information I need to then interact almost face-to-face, but virtually with the patient. I think it advantages both parties to the extent that it offers the patient a cost-effective, efficient way to get access to a very specific specialist, and it offers me to reach out to, frankly, more people at a time that may be more convenient given the time constraints that I have as a surgeon. So, frankly, it's a model that I haven't seen anywhere else. It's been a win-win for everyone, and I congratulate them for their success. And, frankly, the experience I've had with patients has been incredibly gratifying. While I don't meet them face-to-face, we do get feedback after these interactions have happened, and I'm very comforted by the fact that the patients find this to be a satisfying experience, even without physically laying my hands on them, but being able to use all the data to come up with a logical treatment plan that they can then test locally given their second opinion. So thank you for allowing me to participate, and I wish you great success in the future.
So essentially, that is the team physician for the Chicago Bulls. And he said, listen, 2nd.MD makes it incredibly easy for me. I have everything in a cloud-based environment. I open up my laptop. I'm able to see all the medical records. I'm able to have a virtual face-to-face conversation with the member and then type up some notes, and I'm done. It helps me expand my reach. And for many of these specialists, that's the biggest motivator. It's not the money. It's the fact that they can help people in their wheelhouse. And what we do a very good job at is matching our members with those exact individuals that can help them. And so what we've essentially done is that we have expanded the scope of world-class care. It's now available absolutely anywhere from where that member is. So the individual can speak with a world-class specialist from the comfort of their home, surrounded by their family. They no longer need to wait, travel, sit in a bunch of waiting rooms, fill out a ton of paperwork. It's incredibly simple. We provide 3 basic services, and the showcase one is the video consultation with these expert specialists. So these are 20 to 30 minute direct conversations with experts. There's no standard script, there's nothing. It's just an opportunity to have a conversation, get recommendations, get input, that sort of thing. We can also support a text a specialist functionality. So if there's something on a less acuity basis, so let's say I start a new medication, I'm having a side effect, I'm just wondering if that's normal. I can text a specialist, within 24 hours I get a response. Yep, that's normal, and if it continues, you may want to monitor it, talk to your physician. So within 24 hours you get a response, it's going to avoid some office visits. We can also support, similar to Compass, finding local specialists that are recognized for high quality. So we've built an algorithm that looks across 26 different data sets that can identify high-performing physicians in the local network. And we will call and we will make appointments, we will verify insurance, we will do the concierge type of offering beyond that consult. So very hands-on. We have a team of nurses that answers the phone when you call 2nd.MD. So we are very clinically focused, but we're here to simplify healthcare, including the next steps. So we'll make appointments. We'll do a lot of the concierge types of offerings after the consult. So let's talk about results, because I know that we wouldn't be here if this was just a great service and great access. We are able to impact quality of care and reduce unnecessary services, potentially more so than any other benefit available in the employer healthcare space. From a quality of care perspective, 34% of our consults result in a corrected diagnosis. So think back to that study in the Johns Hopkins ICU, they're at 28%, we're at 34%. 73% of the treatment plans are improved. So if you think about that, only 27% of the population is seeing the right doctor, getting the right advice, and is going down the right treatment path. Everything else is waste. And so we are able to address that waste through a simple conversation. And then we can support steerage. So if there are center of excellence types of programs that employer has put in place, if there are other performance network considerations, we can steer into those, and we can be an active part of that type of conversation. Where it really gets fun is around the decision-making process of the consumer. So out of all the consults that we do where the next step would be surgery, 34% of those members voluntarily cancel their surgery as a result of the conversation with a 2nd.MD expert. 34%. Those are 34% of the surgeries just fall off the table because the member better understands their diagnosis and the full spectrum of treatment options. That's powerful stuff. That's Consumerism 3.0 right there. And what we've seen is that in certain circumstances, it's more prevalent. So lower back surgery. What we're seeing is 52 out of 100 people that are coming to us saying, hey, I've been recommended to have lower back surgery. 52 out of 100 are saying, you know what, that's not the right thing for me. So the average savings per consult on a lower back consult is close to $20,000. So it's incredible the amount of variability that's out there, that a little education, a little time, an additional step in the process can help ferret out a lot of that waste. So alternative diagnosis being suggested. As we look across our book, there are a lot of people that are being bounced around the surgical circuit. So they're seeing 5 or 6 different specialists, and they don't get a firm diagnosis. We can help with that. As long as there's been data from some sort of primary care tests and we're able to retrieve those clinical notes, we're able to narrow the focus of what that individual's looking at. Many of those we're able to suggest what the diagnosis is. Other ones where it's high prevalence is on musculoskeletal. Oncology, relatively low at 12%. But if you think about oncology from a quality and a safety perspective from a member, I mean, that is huge. How much are you spending on an episodic basis for oncology services? And if 12% of those are able to be corrected out of the gate before you go down that very expensive and dangerous treatment path for something that's not correct, that can be life-saving. And so a lot of the very billboard type stories that we have, and we have them on a weekly basis, come out of oncology. What we've also found is that female reproductive, so hysterectomies, that sort of thing, There's also a high degree of misdiagnosis there as well. From an improved treatment plan perspective, overall 73%. Musculoskeletal, still pretty high, 71%. Oncology, again, we're talking about the latest and greatest clinical research. 57% of the time, it's not optimized. And I'll give you an example. So there was a woman in the Northeast who had been diagnosed with breast cancer, and it had also spread to her lungs. And she was seeing an oncologist at Mass Gen, a very reputable Harvard-affiliated hospital, who said, listen, I'm going to start you on a very aggressive form of chemotherapy, and we are going to have a double mastectomy. And I think if we do that, we can buy you 12 months to live. So she actually threw herself a retirement party, went to go manage her cancer, and it was, as you can imagine, it was a very sorrowful time for her. She reached out to 2nd.MD. We were able to link her with Dr. Craig Henderson, who is the world's foremost expert in breast cancer. He said, Karen, listen, it's not the breast cancer I'm concerned about, it's the lesions in your lung. Let's try chemotherapy first. I don't think the mastectomy is going to do anything but delay the time in which you could start chemo. And so he prescribed he recommended a lower intensity chemotherapy that's a lot more pertinent for her lungs. And within 4 months, Karen was back to work. It's been 2 years. Karen is cancer-free. But if she would have proceeded down that path with her local oncologist that he recommended, chances are she probably would have passed away by now. So it really is that authoritative guidance that we're able to bring to the table and the reassurance that's just so incredibly powerful. So we've been around for 5 years. Initially, the first couple, we were direct to consumer. And we built it, and nobody came. And so we pivoted after we saw the number of surgeries that were being canceled. And we said, all right, let's follow the money. So we started going direct to employers. And that worked for a couple years. We got some pretty large customers, so Waste Management, Morgan Stanley, Starbucks, and some others, and we've just continued to grow since then. So it's been a very interesting evolution of an organization, and the way it works is very simple. And Clint built this to be the antithesis of what he went through over the course of that year. A member simply needs to raise their hand. They can contact us by phone, email, they can go to our online portal, they can use our mobile app, and just let us know a little bit about what's going on. We will assign a personal nurse that will hold their hand throughout the entire process. That nurse will be assigned to that member. They establish some incredible relationships. We will take care of collecting records. 2015, our average turnaround time for records was 1.8 days. Our competitors are looking at 2 to 3 weeks. So the speed for us, what's the point of having the most incredible doctors available within a couple days if we can't get the medical records? So we collect them, we digitize them, we upload them. We recommend specialists. So again, back to the matching criteria, we're very good at that. We'll let the member choose which particular specialist they want to talk to. We'll give them a choice of a couple. And typically they say, hey, they're both amazing doctors. It doesn't really matter, just let me know when they're available. We schedule the consult around the members' availability. So 62% of our consults are happening on nights and weekends, where it's more convenient for the member and it's more convenient for the specialist. Our care team also reviews the written summaries. So after that conversation, there is a written summary of exactly what was discussed. Any research that was mentioned is documented. And so we do a little bit of an audit just to make sure that it's written at a level people understand, it's timely, it's relevant for that member. And then we'll coordinate any follow-up needs. So this is where we'll help find local and network specialists locally to help execute the treatment plan. And we can also transmit all the medical records we've retrieved. We'll give copies of the written summary of the consultation. So it really is a very, very warm concierge type of benefit after that consult. We'll stay with that member for the next couple months just to make sure if they have any questions or they need any additional support, we're there. So it's not a one and done. We won't kick you out. You always have the number of your care team nurse. And it's great to be able to pick up the phone if you're not sure what to do next. if you put yourself in the shoes of somebody who's going through something really challenging, and you're able to pick up the phone, get reassurance, speak to somebody who knows more than anybody else in the world about that particular condition, you can imagine it's a pretty satisfying experience, right? So we measure satisfaction on every single case that we do. You'll see that the doctor's expertise, their screen-side manner, 4.9 out of 5. Our customer care, which is our nurse team, incredibly warm, incredibly passionate, and that comes through in our satisfaction scores as well. But the one that we can hold up a number one finger for is that we have the highest net promoter score in the entire healthcare industry. So that question, in order to get that score, is would you recommend 2nd.MD to a family member or a loved one? And so we have 9.5 people out of 10 saying, oh yeah, absolutely. It was the easiest healthcare experience we've ever had. So our net promoter score, even though we've scaled pretty significantly over the past couple of years, continues to tick up. We're at 85.42, which is absolutely incredible. It beats Costco. It beats USAA. I came from Aetna. We were a -6, so I've significantly improved my lot in life. And we serve everybody from the truck drivers at Waste Management to the investment bankers at Morgan Stanley. You got the baristas at Starbucks. We've got the retirees at Texas A&M that go in there and just hang out for the rest of the day. So we can cover every single demographic. The communication angles will be different. But what we found is that the most authentic and engagement driving communication tactics we can drive are really those stories of the folks that we've been able to help. And so we look to capture those. We look to work with those employer clients to say, hey, Joe, right down the hall, we helped his family. This is how we did it. And usually Joe becomes the biggest 2nd.MD champion in the entire environment. So we started last year and we won the Health Innovations Forum. This year we've launched our mobile app, what we call a 3-day gateway, which is where we're tying ourselves to the pre-cert or prior auth process. We're pleased to announce that we have a new partnership with MD Anderson, which will allow us to further accelerate our oncology capabilities, getting access to the research. They're oncologists. They'll be performing all path slide reviews for us. So we're really going world class because we've seen just the incredible impact we've been able to have there. And as we look forward, we're looking for similar types of partnerships. We're looking at ways we can deploy artificial intelligence to use all the data that we're collecting. We're looking at genetic testing, molecular oncology, and some very advanced ways that we can help support folks in getting the right care at the right time.